Good afternoon, Assalamu alaikum rahmatullahi wa barakatuh. Welcome to the Friday edition of The Daily Factor. My name is Faraz Patel. I'll be in your company for the next 1 hour. And as we do every day on The Daily Factor, we'll of course start off with our local top story of the day. We then move internationally. And of course, we will be wrapping up the stories from across Africa. And then of course, we go to our community news. And a Friday community news is of course a Friday Juma Nasiya, which will be delivered later on. And then, of course, we go to our markets, and we are glad to say Petri Redingling-Hayes is going to be joining us today. And then, of course, we wrap it up with our sport update. But before we go to our top story, let us just take a look at the COVID-19 stats for South Africa. And South Africa had recorded 11,767 new COVID-19 cases in the past 24 hours, with Gauteng recording 7,500 of it. Now, the positivity rate is sitting at 22.6%. Unfortunately, there were 100 new COVID-19 related deaths recorded during that period. Well, let's go to our local updates. South Africa is officially into the third wave of COVID-19. Of course, we heard President Cyril Ramaphosa on Tuesday, of course, mentioning tighter restrictions to combat the current third wave that we are experiencing. Now, joining me via Zoom to discuss the current third wave, vaccination, and whether there is a need for tighter restrictions, especially in the Gauteng province, I'd like to welcome the chair of the South African Medical Association, Dr. ANGELIQUE COETZEE. Dr. Coetzee, good afternoon, and thank you so much for joining us on The Daily Factor.
Thank you so much for asking Salma's opinion, and a good afternoon to all your viewers out there.
No, it's an absolute pleasure, and of course an experienced and wise head like yourself. That's the reason why we brought you here. Dr. Coetzee, let us start off, of course, with the third wave. We've seen high numbers being recorded over the last 3 to 4 days. What makes the third wave so different to the ones that we experienced before?
First of all, the curve, the incline is much steeper than with the first 2 waves. The second point is we are in winter. With the first wave, everyone was locked down in their houses and homes, and we didn't see colds and flu. Now we are experiencing colds and flu on top of a third wave with COVID-19. All of these symptoms very similar, very difficult to distinguish from a clinical picture at primary care level. Therefore, also experiencing that people who are having a cold or a flu who doesn't come into the surgeries for testing or for an examination will spread the virus if they have COVID-19, but they also don't want to come in. Of course, it's better not to know. It means they can go back to work, as no work, no pay is true for a lot of cases. So that will spread the virus further for us, as well as currently the schools. The schools is a huge problem. And we have seen that the restriction measurements that's been announced on Tuesday night, it's not really making a difference. It's not going to make a difference. You know, got the impression that the president is just trying to pacify each and everyone, and doesn't understand the severity of what is happening at ground level, especially in Gauteng.
Yeah, and I want to touch on Gauteng, Dr. Coetzee, because we see, 7,500 recorded in the last 24 hours, and of course we may see either less or more picture, come the next batch of announcements from the Department of Health. But what needs to be done for Gauteng? Because we see, of course, the national curfew is at 10 o'clock. When looking at this province, do you feel there needs to be changes in order to go ahead and curb the current spread of this third wave?
Well, every day that we allow people's behavior to carry on, we're going to move steeper and steeper up with the incline of this virus. It's extremely difficult to contain this virus. What we are seeing here is already, I think it's too little too late. We need to get people out of spaces where they are in contact with a lot of other people. So you need people to be at home. If you want to drink over the weekend, drink at home. We don't want people to go to gatherings where there's more than 10 people around. We have seen in my area, Eugene Marais Hospital already closed their theatres. There's no theatre time anymore. It is difficult to get patients into hospital admitted. We see that all across Gauteng. And you know, it's 2 weeks. It's between 2 and 3 weeks that this curve slowly went upwards. And we then, as I said, 2 to 3 weeks ago, we already started to warn that there's the wave is on its way. We told the media, and I told the ministerial committee that I'm sitting on, I made them aware that we are going into a COVID-19 third wave, which seems to be currently much worse than the second wave. And this is where we are. So now it's starting to be a bit too late to try to curb it. We're going to go through this, whether we like it or not. It's going to be a tough next 3 weeks ahead of us.
Dr. Coetzee, of course, you mentioned the Eugene Marais Hospital, of course, and the challenges that they're facing. But looking at the overall picture of hospitals across the Gauteng province, and we're especially talking about government hospitals, they are full. And adding to that, you get these trauma cases and other cases that are going to be happening. So, I mean, what do the hospitals need to do? And I'm talking both private and public, to try and make sure that they are adequate enough in dealing with this current third wave.
Well, it's difficult because we didn't train doctors for a pandemic. We don't have enough specialists trained in how, or doctors trained in how to handle this. I'm not even talking about the nursing component. That's even worse. So you can, and we don't have the manpower. We don't have enough doctors. So you can only look after so many people on a daily basis without getting fatigue. So once if you start to get emotionally fatigued, it becomes difficult to treat your patient, because you, who is the caregiver, now also become someone who needs to be given care too on an emotional level. And that is, you know, we call it PTSD in the end of the day, anxiety disorders. And I can tell you that is already starting to happening again, because those doctors and nurses are put back in exactly the same situation that they had, that they encountered twice before. And in any psychiatric environment, you know, you don't want to go back to the same scene, which was initially responsible for your emotional status where you currently are. And this is what we're going to see. So what do we need to do? We need to train doctors more appropriate to be able to handle the stress, as well as these difficult pandemics, because this is not going to be our last pandemic. We need to make sure that the public out there understand their role, what they have to do. It's a teamwork. It's not only the government's responsibility to make sure that I stay at my home. It's your responsibility as a responsible citizen as well. And again, training. We can have as much beds as we want. We can open up field hospitals. But if you don't have a doctor or a nurse to look after the patient at that level, it's not going to work.
Dr. Coetzee, the vaccination, we've been seeing, of course, governments, rollout of the vaccination. Do you feel the target that they've met so far is enough at this very moment to achieve its herd immunity? And the second part of it is also, has government achieved in its aim in what they're doing right now with regards to the vaccination?
No, answer is no on both. The government said that they are going to vaccinate 5 million people before the end of this month. So the prudent thing would have been to say, listen, we had a problem with Johnson & Johnson. Well, everyone knows it, but to come out and say, listen, we're not going to reach the target. It's virtually impossible. So let's try to vaccinate those ones that we can vaccinate above the age of 65. They're estimated again there also to be around amount of around about 5 million people. For now, around about 3 point, I'm not sure, I think between 3.2 and 3.5 people are registered above the age of 65. Of that, nearly half has been vaccinated. And on top of it, within the next 2 weeks, you need to start with the second vaccination of those same people. So all that we have for the last four weeks is to say we vaccinated around about 1.34 million people. That's with 5,000 sites. That is not that's not an achievement.
Dr. Coetzee, one final question. What would need to push government in order to get them to do, more tighter lockdown restrictions? And we, of course, do hope that we see an increase in the recovery rate. But let's just say the third wave does get much worse. I mean, would there have to be higher numbers than we are right now in order to force government into a tighter restrictions? You, of course, mentioned that this should have been done a long time ago, but what would have to make government wake up in order for them to go ahead and push for those harsher restrictions?
I think it's time that they start to listen to the people on ground level. They need to see what is really happening. An organization like the South African Medical Organization is actually a very powerful organization. And if you don't listen to us, and if you don't take us into consideration and ask us for our advice, we will tell you the right thing. We will not set you up for failure. You set yourself up for failure. And if we can work together and with SAMA and other doctor groupings out there, I think we would be able to, in time, curb what needs to be curbed. But for now, I'm afraid we are going to have to go through this third wave in the difficult circumstances that's still lying ahead for us within the next 3 weeks. We haven't seen anything like this. We thought the second wave was bad. Watch out. This one is going to be worse.
Dr. Angelique Coetzee, the chair of the South African Medical Association, we'd like to say thank you so much for making the time for us. And of course, through your busy schedule that you are currently consulting patients, we really do appreciate it.
Thank you so much. And I want to ask each and everyone, please stay safe. Please do not go into any place where there's more than 10 people. Stay at home. You're much safer there. Thanks.
Well, there you go, Dr. Coetzee, just giving us all, as South Africans, a word of advice right there. And I think, to add on to that, these cases are going to continue to rise even much worse than what we are experiencing. Of course, I did mention 11,767. Tonight, it may just go up much higher than that. Even if it goes much lower than that, it's a role for us as South African citizens to go ahead and keep safe during this time. Just go to places that you need to go to and try and avoid large crowds. And hopefully, every single citizen can heed just as what Dr. Coetzee is saying, and many other, healthcare specialists have warned us about with regards to the third wave of COVID-19. Well, stay tuned to the Daily Factor after the break. We'll, of course, be wrapping up our top African stories from this week. Stay tuned.